Good afternoon. Thank you so much for coming. My name is Bob Chen. I'm the interim dean for the School for the Environment here at UMass Boston. And it is my pleasure to welcome you to the second lecture in the Chancellors Lecture Series on climate crisis to climate resilience. Today's topic is of utmost importance. It's how climate change, the existential crisis of our times, affects people and people's health, both locally and globally. And so to start this off, I'm going to introduce the Chancellor Marcelo Suarez Orozco, a man who needs no introduction, and it is his week. It is inauguration week, but we're going to put him off. We're going to put him to work right away to have an in-depth conversation with Dr. Vanessa Kerry.
Thank you. Thank you so much. Thank you. Bob, good afternoon, and welcome to the second presentation of our inaugural Chancellors Lecture Series at UMass Boston, From Climate Crisis to Climate Resilience. I'm delighted to be here, and I'm delighted to host what I think will be an engaging conversation. The Chancellor's Lecture Series was established this academic year to engage distinguished thought leaders and scholars on the defining challenges of our times. Many of you will recall that we kicked off the series last November with a presentation by Dr. Ram Ramanathan, who in 1975 discovered the greenhouse effects of the CFCs and showed that each ton of CFC-11 and CFC-12 has more global warming impact than 10,000 tons of CO2. Ram shared with us a groundbreaking mitigation, adaptation, societal transformation strategy for bending the emissions curve and build resilience to climate stress. Today, we will consider a profound and far-reaching matter, the impacts of climate change on global public health. And we are doing this with a leading expert in this area, Dr. Vanessa Kerry. Climate change poses a grave danger to every aspect of public health and clinical medicine. Cyclones, monsoons, floods, hurricanes, droughts, heat waves, forest fires all increase risks of zoonosis and food, water, and vector-borne disease, in addition to causing and exacerbating non-communicable conditions and undercutting maternal, child, as well as mental health. Furthermore, climate change is undermining many of the societal determinants of good health, such as well-being, livelihoods, equity access to healthcare, and social supports. Air pollution from fossil fuels alone lead to over 5 million premature deaths in children and adults every year. We're particularly concerned that over 3.6 billion people on Earth live in areas highly vulnerable to climate change. For them, extreme weather patterns are the new drivers of forced migrations and resource-based conflicts. An average of 21 million folk have been forcibly displaced by weather-related events since 2008. The World Bank's report, Groundswell, estimates that climate change could force an additional 216 million people across 6 world regions, or across or within their countries by 2050. More recent report just shared with me by Melissa Hoffer, our climate chief in the Commonwealth, indicates that well over 1 billion people are likely to be displaced globally by climate change by the midpoint of this century. Meanwhile, the toll climate change takes on mental health is staggering. Forced relocation, migrations due to weather-related events result in trauma, post-traumatic stress disorder, depression, and other conditions. And of course, climate change places enormous strains on the entire healthcare system in terms of costs, equity, access, and quality. And that's in regions where there are working public health systems. The impacts of climate change on global public health are grave. Resources and investments in shaping more resilient public health systems are vital to ensure that we can meet the healthcare needs of all as the consequences of climate change will continue to unfold. It is with our eyes wide open that we must tackle the challenges ahead to forge a path to climate resilience, to forge a path to a humane, sustainable future. And it is the task of helping us open our eyes wide, that I have a great pleasure of introducing our very special guest, Dr. Vanessa Kerry. Dr. Kerry is a co-founder and CEO of Seed Global Health, a nonprofit organization focused on health systems strengthening and transformation through long-term investments and training of the healthcare workforce. Under her leadership, Seed has helped educate more than 34,000 doctors and nurses and midwives in 7 countries, helping to improve healthcare for more than 70 million people. In June 2023, Dr. Kerry was appointed the World Health Organization Special Envoy for Climate Change and Health. I've worked closely with Dr. Jeremy Ferrer, and I know of the extraordinary importance of her endeavors under that responsibility. She has spoken and written about the effects of climate change on human health systems, and the need to integrate a health-centered response to climate change mitigation and adaptation measures. Dr. Kerry supported the United Arab Emirates COP28 presidency to shape the first ever COP Day of Health on December 3rd, 2023, and continues to lead efforts globally to build advocacy around the impact of climate change on health and ensure equitable justice climate action. As co-chair of a work stream on the World Health Organization's Public Health and Emergency Health Workforce Roadmap, she's helping galvanize consensus for investments in health surveillance, detection, and treatment for the next pandemic. She's a critical care physician at Massachusetts General Hospital. So this is the family. We have a big new initiative with Massachusetts General Brigham and UMass Boston. So as we say to our friends at Massachusetts General, mi casa es su casa. Dr. Vanessa Kerry. Give her a warm beacon welcome.
Thank you. Hi, everyone. It's nice to be here. And congratulations on this new tenure. It's really wonderful, after having a moment to speak, to know that we're going to have someone thinking about the right things at the right moment who's at the helm of this important institution. So
thank you.
Grateful.
Thank you so much. So in my culture, being fashionably late is expected. But I'm being inaugurated after 4 years as Chancellor because of the pandemic and because of so many other issues. One of your many roles is as founder, CEO of Seed Global Health. Tell us about the mission, the vision. Tell us about the work.
So Seed Global Health was founded to ultimately fill the fact that health is the single most important thing we need to, I think, be able to thrive, care for our families, do what we need to do. And yet, to deliver health, you need people. Healthcare is fundamentally a people-centered intervention. You need a healthcare worker to hang a bag of blood. When a woman is hemorrhaging in childbirth, you need someone to hold your hand. If you are dying and you are scared, you need someone to do the life-saving procedures that we need to intervene. And so there is no health without healthcare workers. And yet we as a globe have failed to invest enough healthcare workers such that there is a shortage of millions of healthcare workers in many places around the world. And in sub-Saharan Africa, where I spent a long time working, there's a critical shortage of healthcare workers to deliver services. And so you see people die of diseases that are preventable. They die necessarily because they cannot get the services they need. So we founded Seed to fix that, to build a generation and a cadre of healthcare workers who are skilled, well-trained, able to deliver services to those in need, but importantly, can teach and train others, either across the health system or their successors. So it becomes, and that's why we're called Seed Global Health. We are planting seeds that grow year after year, time after time to care for people. It's taken us over a decade, but in what I would consider a short amount of time, we've trained over 47,000 doctors, nurses, and midwives in service to over 76 million people on the continent. And more importantly, we've transformed health outcomes as we have done it. In one district where we've worked in Sierra Leone, highest maternal mortality rate in the world, in the country, 50 times the likelihood of dying in childbirth in Sierra Leone than here in the United States. After just a year and a half of educating and training and partnering with the Sierra Leonean government, we in that district have helped drop maternal mortality by 60%. There was not one maternal death for the first 5 months of 2023, for example, and then we replicated that over subsequent series of months over the course of the year. And so the mission is to deliver healthcare to all everywhere because there's a qualified, compassionate healthcare provider able to meet the needs of the population.
Thank you. Maybe we'll come back. During about a decade, I worked closely with Paul Farmer, and we lost him, and he was our partner in a very large initiative on migration from the Caribbean to our country. We'll come back to the role of universities in getting in front of these increasingly catastrophic developments. More heating during the next 50 years is likely to lead to a staggering $178 trillion in terms of costs, millions of premature deaths, new epidemics, forced migrations, the implosion of vital food systems. We're coming out of a wicked pandemic, shook the world. How are we preparing for the coming impacts of climate health?
I'm laughing because I'm not sure we are preparing in the way that we need to. The truth is the climate crisis is a health crisis. We see this in every day. You know, you mentioned in your opening remarks that over 5 million people a year are dying from the effects of air pollution directly caused from fossil fuels. So we are driving this conflict, and when you think about the 5 million deaths, that's almost as many as we saw in the entire COVID pandemic over multiple years, and we're seeing that every year happening. And so I think that, you know, we're seeing climate change impact everything we do, and it's accelerating, right? 2023 was an apocalyptic year. When you look at the extreme weather, the extreme heat, the smoke over New York, you think about the degrees that we have seen our Earth, you know, it's first year that we crossed the 1.5 threshold consistently. So we're facing something real. And the problem is that if we don't address the health burdens of climate change, it's going to cost us. Every delay in responding to this moment is going to cost us economically, it's going to cost us in our security, it's going to cost us in migration, but it's going to cost us in lives. And so we have to take a health-centered approach to our response to climate change. Climate change is hitting every aspect of our human health. Non-communicable diseases, heart attacks, strokes, kidney disease. We're seeing it in vector-borne diseases where, in the next several decades, over half the world's going to be impacted by dengue, for example. In places that we work in sub-Saharan Africa, we've gone from seeing 2 people to a bed during the peak of malaria season to 6 to 8 people in a bed during the peak of malaria season. There's a study that just came out that showed that the risk of stillbirth increases by almost twice because of extreme heat. And yet we see extreme heat in India, in the US, everywhere around the world. And so we see it in our mental health crisis, we see it in every aspect of our health. And so we're feeling this, but we're not necessarily accepting it, acknowledging it, or investing in it enough. And I think that's the opportunity, is to understand all the different ways that climate change is impacting our health, both directly, but also indirectly, in terms of our productivity, our incomes, and then our ability to access health after. And so that is part of the job that I have in this role, and that is part of, I think, all of our job as academics, as politicians, as leaders, as citizens, is to really understand that climate change should not be just measured in terms of degrees Celsius up or averted, but actually in lives lost and lives saved. And that is really what we're fundamentally talking about, is our humanity and our survival.
Talk more about why the denial. While we're not taking on climate change and its health impacts with our eyes open.
It's the million-dollar question. I think that often we're resistant to change, and I think that the world has been changing very rapidly, and I think that people have been feeling like they are less safe. I think people feel often that they're losing what little they may have, and they're trying to protect it. And for many people, that means their livelihoods, their income. And so climate change and how we manage climate change has remained a choice of kind of giving up what you have for the global public good, if you will. Don't drive your big car, don't buy your gas, don't burn your fire or whatever it is, because, or don't, you don't use a plastic bag, or, we're telling people not to do things, but we're not giving them the alternatives, and we're not giving them the information they need to know why they're harming themselves, right? Fossil fuel burning, we spend 6 times the cost in managing the health burdens from burning fossil fuels than we do, for example, on the fossil fuel subsidies that we're doing to make fossil fuels available to people. So we're not, as leaders and decision makers, necessarily giving the alternatives. South Africa is a terrific example. South Africa made the bold decision to close down various mines and coal mines and to be able to move away from this sector because it was the right thing to do for the environment. But it was very hard for them in their economics to make the just transition for those workers. And so what ended up happening is that no one was coming in to support that just transition. So you're not giving the country an alternative except to keep the mines open, if you will, because where are those jobs coming from? It's the same thing in health. We need to help people understand their children are more likely to go to the emergency room with an asthma attack because the buses with fossil fuels are running through the neighborhood, then maybe to make the upfront expense as a community or as a state or whatever, to make the buses electric, reduce the fossil fuel burning, the air pollution that is driving people to the hospitals that is costing the state more. We have an opportunity right now to change the data, to change our understanding of what we're actually losing from our decisions right now, and to help think through what those just transition plans are. But it's incumbent on all of us who are in positions of power, information, evidence, change, to help create those alternatives so that people don't deny because that is all they have to hold on to what they're trying to preserve safe. But they understand that there's a pathway to something better, healthier, and safer that they can take that can provide a better and more whole life.
I'm happy to say that it's the Commonwealth, and it is a proud UMass Boston alumna who wrote the legislation in a way that shows the pathway to the opportunities. Not that we're taking away this, but here is the entire universe of new pathways to a more sustainable job, world, health, greater flourishing. And the Commonwealth, in many ways, is at the forefront of developing the architectures that will be required to move us into a sustainability algorithm that will create good, public good, and new opportunities.
I think we also have to start to demonstrate the evidence that is out there already, though, and to be able to capture it and to tell a story. I mean, for example, Seed Global Health is training family medicine physicians in Zambia. Family medicine physicians can take care of 80% of the health problems that are presented by climate change or within the communities acutely. They manage across maternal child health, non-communicable disease, communicable disease. It's a very sound investment when you think about building resilience, the theme of what we're talking about today, because it builds a resilience to the health system. But there's not enough evidence telling the power of that story, of what that upfront investment can yield in terms of the pathway. So we need to create those roadmaps and those pathways, which are terrific, but we also have to show how they work in the places that those investments have been made to, or to really invest in those and learn in iterative feedback loops. This is working, or this isn't working, and we're going to adjust. But to be willing to kind of put those investments up front and then to show the pathways that, and then to demonstrate why they're successful.
I love your response to this. I asked the Minister of Education of Rwanda what she thought about first when she woke up in the morning. She's responsible for the education of the kids. And she said water, without missing a beat. It's water and the availability of water.
Water is a core public health need in this world. When you think about what are some of the most fundamental things, we have fresh water, our bodies. I'm a physician, we have to have a certain amount of water a day to be able to survive. But water is also critical from the standpoint that it can host vectors, it can be responsible for cholera outbreaks, it can be responsible for dengue and mosquito outbreaks. And so the management of water in communities matters immensely, both for access for communities to be able to have it for their health and well-being, access also in an indirect way. So there's increasing studies of women in Kenya, young women in Kenya, having to walk farther to get water, because in many parts of the world it is the woman's job to have to get water. And they're being sexually assaulted during these longer journeys. And so we're seeing their safety is being compromised, but we're also seeing their health compromised because it's actually making it harder to manage the HIV epidemic, as we're seeing people get more infections from this increased assault and this increased need, and some of the ways that people's lives are shifting in the setting of climate change and water. We're certainly seeing changes in salinization affecting women's pregnancies and access to water, the way things are shifting in terms of how the climate is changing and there's access to fresh water. And water, clean water, healthy water is just a fundamental aspect of sanitation that protects our public health. Back in the days of John Snow at the heart of London, who figured out that, the cholera came from the water pump, to where we're seeing in Malawi, where we work now, where there is a cholera outbreak, the largest size and scale in history, from an increase in tropical storms that were coming through the region, that the country had to basically shut down its schools, shut down its businesses to manage, and the cost of that. Over 30 countries around the world have cholera outbreaks now. That is ridiculous in 2024. And that's what we're seeing from climate change, is we're seeing a loss of the progress that we've made on the Sustainable Development Goals, a loss of the progress we've made in health. We've poured billions into public health in the last 40 years. And yet we are losing ground. That is the opportunity that we have if we take a health-centered approach to climate change and we invest in strong, resilient health systems. Because if we do that, you are not only able to manage the changes and burdens of disease from climate change, you're pandemically prepared. We saw in COVID, over 90% of countries had disruption of services because the systems weren't ready. Everybody freaks out. How do you invest in health systems? It's like an amorphous concept that people, I think, don't know what to do, right? How do you invest in health systems? It takes too long. It's too complicated. Where do you start? Simplify it. You start with healthcare workers, because it turns out healthcare workers on the front lines can be resilient and adaptive. Chancellor Banda, when the bridges washed out in Malawi from Tropical Storm Freddie, realized that there wasn't access to maternal services for women. She went to the Ministry of Health and she advocated with a plan about how to build new centers that could be in service to women, such that no woman or child who delivered in that catchment area died over the course of the time that system had to get set up. We know that they are the front lines of surveillance when an outbreak is in a community. They're the front line of response. They'll tell you if there's no blood in the blood bank, and they'll tell you that's what you should invest in. They'll tell you that the single most important investment is clean energy and clean water to their health centers. And then when that's filled, they'll tell you what the next most important thing is to save lives in the community. They are your roadmap for strengthening health systems. So we know actually how to do it. We just got to choose to do it. And it turns out you can save money and create jobs, and 70% of those jobs are occupied by women. So you actually can have gender equity from this. So you can transform countries and communities when you invest in health systems. And that is a huge opportunity here that I think we can take. And I think that we can build that resilience going forward.
We talked about children, we talked about maternal health. You've talked about the very significant endeavors, Seeds and your team in Africa. I want to talk a little bit about the ethical issues of what we're facing with climate warming. Approximately 4 billion people, accounting for about half the world's population, are responsible for 88% of the emissions. At the same time, the other half contributes less than 12% of the emissions. And according to World Health Organization data, 75% of the losses from climate impacts reside in those most vulnerable areas. The top 1 billion on Earth, you do the math, that's North America, Europe, account for about half of the total emissions. So there are two ethical vectors here. One is the transgenerational. What we're doing today is we're robbing children of a future where they flourish in and with nature. So that's the first ethical vector. The second is those who today are least responsible for emissions are paying the gravest price. Help us as a doctor, as a leader in world health, public health, help us address with a health lens what these data tell us.
I mean, with a health lens, what it means is that those communities that are already disadvantaged, have the least amount of resources to be able to provide basic health services, are those that are getting impacted by the health changes the most and have the least amount of resources to adapt. So when we consider a couple things, it's stark. Malawi, again, to use that example, has about $34 per capita to provide basic health services. It needs 76 just to meet the basic package of services recommended by the WHO, and so do the countries. So you already have a gap. You then compound the vulnerability of the number and size of storms it is seeing in climate change, and the drought and the other impacts that are happening. It's all manifesting as health, which is further then creating a vicious cycle of poverty, insecurity for these countries. Because it turns out, to work, you have to be healthy. It turns out, to have a healthy population, you have to be able to provide health services. So you get stuck in this, and if you're not healthy and you can't go to work, you can't attract private sector or other development. You can't have a workforce that can respond to this, and it gets caught in a cycle, and we're seeing this consistently. The economic costs of poor health are incredibly real too. We know, for example, that the effects of air pollution, the health effects of air pollution cost and economic costs are about $9 billion a day in 2018 is what it was costing the globe. So we're seeing very direct health impacts. We know that the US lost $100 billion in productivity from extreme heat. People couldn't go out, they couldn't do their work. So there's economic costs there. So we're losing from the health impacts. So if you have a country that is already disadvantaged and you're loading that on too, you're making it almost unsurmountable to be able to change the narrative or to get out of this vicious cycle. And so we are just driving inequity with the decisions that we make today. And I think that, and that fundamentally has to change. And so the question becomes, how do we change it? We have a real challenge of political will right now. It is being driven by an economic bottom line of private sector and others that are, I think I read the statistic that 2/3 of the world's wealth was basically consolidated by the top 1% of the world in the last couple of years, which is very stark. So there's less resources available to these countries to be able to do this adaptation and resilience. So that's one problem. We have leaders that are more worried about their election than they are about the long-term impact of what they're doing. And so we need, I'm not saying all leaders are like this, but there's some very important leaders that we need to, where we really need a new and courageous leadership that is able and willing to make some of these long-term decisions that aren't just about, that are about creating a better path to equity and are about humanity, right? We should not be living in a world where there are two such different standards of care in the world. We should not be living in a world where people are falling deeper and deeper into poverty, where 1.2 billion people are going to be migrants from climate change and lose their homes, lose their security, lose their culture, lose their family, lose their future by now in 2050. And yet so many of the decisions we make are doing that. And so I think there is an opportunity for us to think about how do we create the arguments for equity, the arguments for this humanity going forward. Now, I would love to say investing in global public goods would do it, this idea, but we saw in COVID that didn't do it, right? We tried to say as public health people, no one is safe until everyone is safe. And it is most important that the most vulnerable get the vaccines first. What happened? We hoarded vaccines and we wasted them and they were not made available to people under any circumstance. And what ended up happening was it wasn't just that people didn't get vaccinated for years and people died of COVID who didn't need to or were made vulnerable to it. But the damage that was done across goodwill and the ability to create, a world in which we live on a very small globe with a shared future, because it turns out greenhouse gases, malaria, dengue, these diseases don't stop at borders. We're all vulnerable. But that collective moment doesn't seem to exist for us necessarily as a lot of the political leaders. So how do we create that? The question that I have is, okay, fine. I might be motivated by global public goods and by the moral code of being a human being and a physician who wants to do no harm and to care for someone else. But I will recognize that there's a lot of people out there who aren't. So what I will do, and we will do this at SEED, and we're working on this, we want to create the argument, the evidence-based argument, economics, security, whatever the vested self-interest is, but that evidence base that actually moves us, though, to a pathway where we see that moral good. We want to get people to invest in global public goods because, yes, it's the right thing to do, but we'll point out to them that for every $1 billion they invest in adaptation and resilience now, they'll save $7 billion in loss and damages. We will point out that if you build seawalls for $1 billion, you save $14 billion in damages on that front. We will point out that if you invest in strong and resilient health systems, you can actually have a workforce that can give you a return on your investment. And I think if we can just be pragmatic about where some people's minds are who hold the money and power, but give them the evidence base they need, they will want to do well and do good at the same time. We just need to help them get there. But we have to, I'm all for, but so I think that that's the way that maybe we can help meet this moment, close some of those equity gaps and get us to the place that we need to be. Because the moral argument has not moved enough of us. It inspires, but it doesn't change behavior. We have to change behavior, and we have to change it urgently.
Thank you. One of my mentors in the area of climate is our colleague Ram Ramanathan. And Ram once told us, when I began this research in the late 60s, this was going to be my grandchildren's problem. And it was going to be in a faraway island. He stood up in this stage here at UMass Boston and said, today, it is my problem, and it is in my backyard in La Jolla, California. So, as a friendly amendment to your vision, this is coming to a neighborhood near you, as they say in Hollywood. It's no longer an issue out there.
Nope.
This is an issue that you've noted knows no boundaries. These are the original migrants. So how much do you think that factors in the kind of change, the behavioral change, the cultural change that is urgently needed? There's a gap here. There's a gap between mitigation, the gold standard, we need to decarbonate the economy, we need to decarbonate the society. Ram, in his lecture, said, this is numero uno. There's a gap here. There's a gap, and the gap is going to be 2 generations. And the shocks are going to be increasingly wicked and increasingly devastating. So it's everywhere. It's coming to a neighborhood near you. How much is that part of how we need to be thinking about climate?
So I think that's one of the tools we have, is the reality is that climate change is here and now. We are feeling its effects here and now. I think businesses are seeing their supply chains threatened. I think that we're seeing and the impact is being felt. And I think that actually that's helped us to get where we need to go, right? If you looked back at 2015, we were on track for 4 to 5 degrees Celsius, right, increase. And we're now at 2.4, 2.6, pessimistically 2.9, but that's progress. So if we take this not from, and I am nothing but an optimist, I think there's been actually some terrific progress that is starting to happen. We are starting to see an acceleration towards bringing people together. China came in, we talked fossil fuels, COP28, the word fossil fuels came out, right? As the driver of climate change. That's a victory. Now, it didn't say phase out, it said, transition from, and agreed. Phasing out of fossil fuels is the single most critical sort of piece that we can do here, because it is driving everything that's happening. But we are making some progress, and there is reason for optimism, and there are a number of governments that are stepping up and trying to really accelerate their pathways to net zero. We're seeing companies come in now and accelerate to net zero. You are seeing a younger generation that is creating political and social pressures around doing better by the environment, and I think we're seeing progress there. 150 countries signed on to a declaration for climate change and health, which is a real statement of understanding at least that nexus and intersection, and was unprecedented. And a number of countries came in with very strong annexes that spoke exactly to the targets and things they want to do for climate change and health. And that is all progress. So people are feeling this moment, but I want to make sure that we are looking at the full range of opportunities here that we can take to go forward, because I think a lot of that optimism and that movement has been in the mitigation space. But if you look at climate funding, for example, only 2% of adaptation funding has been towards health, and only 0.5% of all funding, climate funding, has been for health at all. And so, when I think about the fact that health is the way that we as humans are being so personally impacted by climate change too, and the ramifications it has across our economies, our security, and all those other pieces, we could be doing better there, for example. So there is reason for hope. There is reason that I think that the fact that we're feeling it today, we are starting to see people change their behavior. But we still have a lot of room to do to make the decisions they make, not just be reactive, but be really thoughtful about this moment to meet the resilience and adaptation in a way that can be win-win. And I think that's the space that I very much see, is that opportunity, especially in the climate and health space, where people are not necessarily understanding the ways that there could be an opportunity. I think that there's a lot more we could be doing.
We have elections in our country. We have elections in India. We have elections in the UK, elsewhere. How do you see climate change and health receiving? Are we talking about climate change and health in these
In the elections,
election years?
We're not right now. I think that we are seeing climate change is certainly a topic for elections. I think a lot of it is around energy, access to energy, green energy sources, the mitigation side of things. The climate, and there is a role, when we think about mitigation, we should be mitigating harm too. And that's where the climate and health conversation comes in very much. And so we need to do a better job to get climate and health centered in the health. And I think it could be a very powerful point for elections and for mobilizing support or not for certain candidates is being able to bring those links together. But we also need to bring that evidence forth a little bit better so the political leaders understand how much their constituencies are being impacted in terms of health for climate change and what that means for the security, the individual and human security of their communities, a person's ability to go to work, to put food on the table for their family, or to be able to participate in their community or their society, and what that then rolls up to on a national level. And so one of the things that we are certainly trying to do is to raise that political flag for countries to understand that intersection, both working at the G7 or the G20, working through various allies to bring that argument forth so that it is better understood and there is more focus and engagement on the climate and health nexus. Again, we are seeing progress, but I think that there's still an opportunity for us as physicians, as academics, as a health community, to be able to really empower leaders to understand what's at stake.
When the great Algerian writer, maybe author of one of the most important novels of the 20th century, won the Nobel Prize, Albert Camus, said, "Where there is no hope, we have to invent it." I give you Dr. Vanessa Kerry, an inventor of hope in a very, very existential domain. We're so grateful for the conversation. Thank you.
Thank you for having me. Thank you very, very much. Thank you.